Hi again, glad you could be here. I wanted to just amplify a little bit on a theme that I've been covering quite a bit. I mean, a lot of my statements are cautionary, warning you about what I feel is the unscientific nature of psychiatry's diagnoses, about psychiatry's role in the courtroom, in psychiatry's role in many, many decisions about social policy. I want to just branch out a little bit in the sense that the risk of information which is misleading can come from other sources too. It's so widespread now. It's not just what psychiatry is claiming, not just what maybe pharmaceutical claims companies, government that you need to be cautious of, but just information in general from sources that maybe you weren't expecting it. I give you an example. I was recently watching the news, and there was a guest on the news, a young woman by the name of Jamie Lowe, who has written a book, and she was there to discuss the book. It was called Lithium, Love, and Losing My Mind. And she was very much promoting the help that she had received by taking lithium. And she had been started on it as a teenager while still under her parental control, but continuing on into her adult life, and had been on it for 20 years. But was talking in great detail about how much she felt it had helped her. I was then particularly struck by the way she was introduced, that the news program had actually taken the trouble to call the American Psychiatric Association, and they had for information about lithium, and she had been told that lithium was a treatment for the brain disease of manic depression. So right there, it's an example where information bureaus are ready to respond to calls from news agencies and obviously journalists and people like that, labeling these things as brain diseases. The fact is that there are no mental disorders which are known to be due to diseases of the brain. None. There are neurological conditions which can present with mental symptoms. There are medical diseases which can present with mental symptoms. And we've talked about how important it is to make a proper understanding or diagnosis if it is a medical condition like that, and a recognition that in those cases where it's not a medical condition but a mental problem, we don't have a medical condition that can be diagnosed. So here's the American Psychiatric Association Information Bureau misleading people by labeling it as a mental disorder, as a brain disease, as a brain disease. So as Jamie Lowe went on to describe her situation, I was really terribly saddened by the more I learned about her situation. Pleased that she did well in her life as years went by, was able to settle down in some of the behavioral issues that she had, went on to her career in journalism, writing books. But she also reported that she's going to have to stop lithium because her kidneys are not functioning or nearly collapsing. I don't remember exactly. But that's been something that's known since lithium first began to be used in the 1970s. Lithium is a compound which is not good for the body. It doesn't occur in the body. And it's really not surprising that that would be true, because lithium is a light element. And most importantly, it sits in the periodic table of elements just below or above sodium. That means that chemically it will act like sodium. The number of electrons in the outer orbit is very critical to how a chemical will react in living systems and in non-living systems. So it should be kind of fundamental to question whether lithium is replacing sodium or competing with sodium. And given the fact that sodium is such a central part of the body, sodium chloride is of course salt, and salt water is the basic ground in which the body exists, or the life exists, all the way from insects to humans. Salty water is the matrix. So lithium, to interfere with sodium metabolism, is bound to be a critical part of why lithium would be poisonous to the body. I guess I would just finish up this session by emphasizing that it's one thing if a patient decides to take a substance on the recommendation of a doctor because they come to an understanding that despite the fact that this substance is potentially damaging to the body, that we think it offers something good enough that it's worth it. That's what we call the risk-benefit ratio. That is a part of medicine. Doctors are supposed to inform patients of the potential risks and the potential benefits. And if the potential risks are low enough and the potential benefits are high enough, the patient can decide to go ahead. But when a doctor forces it on you, and you put yourself at risk, and the information behind it is not accurate, you're talking about major wrongdoing on the part of a doctor and a patient in that situation. And my feeling is that somebody like Jamie Lowe, who was told to take it, and she was made to take it as a teenager in the beginning, and then apparently told so many things of the nature that she was telling the audience on the news program that were complementary to what lithium is supposed to do for you, that I cannot accept. And I hope you will do some serious thinking whenever such things come into your life. What is the information that I'm getting? Is this merely latest fads or promoting psychiatry, promoting drug usage? Be careful. Be careful. There's a lot of information. I want to see you next time. Come back. Thanks a lot. Bye.